there's a couple kind of things that are imminent, if you will, that are, I think, going to be, at least get people thinking differently in the area of epilepsy. So, clearly the whole area of rescue medicine, it's been there historically, but really the improvement in options and the number we have now and we'll have kind of this year as they really get out this year is the best we've ever had. So that whole concept, much like the asthma example I used, I think will actually finally come to fruition for the majority of our patients that basically didn't have it before. So I think that'll be, a huge one. Going forward, there are new medications that will hit as well for epilepsy, so that'll actually be nice. It's hard to kind of say, how do we get the information about new medicine if we're not kind of like, going into doctors' offices, if we're not, having these interchanges, it makes it a little more challenging to get information out there to the docs that are treating the patients. So I think those will hit as well too. And then I think the other one that'll actually be interesting is trials will start this year for it's a niche, but it's the first time we've done it in epilepsy where it's a genetically caused epilepsy where actually treatment trials will start that actually are not treating the epilepsy per se, but they're aimed at kind of basically fixing the genetic problem, which causes the epilepsy. So we're actually tackling, the problem. And again, that's a small subset of patients, but at least this gets us into the concept of thinking, okay, we're not just treating the symptom over here, the epilepsy, we're kind of going back to, okay, it started here with this genetic pain, let's treat that. And that's a real different mind shift for what we've done ever in the treatment of epilepsy. I think the biggest thing we've heard from our patients, a lot of patients that are, even well-controlled epilepsy have kind of said, well, gosh, if I'm otherwise healthy like me or you, and I'm, on my seizure meds, I happen to have epilepsy, if I get this, am I any more at risk? And I think for most of our patients, we've said, listen, you're really, not. I mean, yes, you would feel sick just like if you got the flu or something else, but, unless you're, really ill and you end up, in the hospital or the ICU, obviously that's a problem no matter what's going on. But for your average patient, we don't want you to get this, but, if you do, stay on your medicine, don't alter that. And we should be good. It's the very rare patient that we would expect it to really kind of kick up their seizures or have a change like that. So, again, it's kind of trying to take the edge off that anxiety some as well, too.